Hi everyone, I'm Dr.Z. I'm a clinical psychologist specializing in adult transgender care. Welcome to my channel. If you are new here or a regular viewer but have not yet subscribed, please make sure you do subscribe. This way you are helping me and a lot of other people find this content. In the very least, if you like the content that I create, please just like this video. It also helps algorithm to just circulate it and for other people to find it as well. Welcome to our Q&A series. This is a series where you ask me a question and I randomly select 4 questions and I sit down and I give you the best tips and guidance that I can possibly offer. So if you do have a question for me, go ahead and email it to me. Email is below in the description box and I would be very happy to include it in our Q&A. As always, I blocked out any kind of identifiable information for privacy reasons, and there will be timestamps below. So let's get started. I have 4 great questions that I randomly selected. Let's go through this. Question number 1. I wonder what your thoughts are on the idea that transition is not much different than any other sort of body modification someone might undergo. As an example, someone might get tattoos. I wonder why it is seen as such a taboo to change gender expression, much like how it was once taboo to have tattoos. I hope that in the future people will see transition as just another form of this kind of thing. Perhaps you could say that transition is a much bigger change, but maybe it is only a difference of degree, not of kind. This is an interesting question, and as I read it at first, my mind immediately tried to think, well, is it really the same thing as getting a tattoo? One of the things that jumps to me immediately in regards to this question is that tattoos are, a form of self-expression. They are something that, a person decides to do. They seldom necessarily are solving a pain point. Sure, we can argue that there are people who get a tattoo because they're going through a grief period, because they're going through the loss, and so they're getting a tattoo as a way to commemorate a particular moment in their life. But the need for tattoo in of itself doesn't necessarily arise out of a pain point the way a need for medical and surgical intervention arises out of the distress and the severity of the distress caused by gender dysphoria. So that's one of the things that jumps to. Another thing that I'm thinking about is, to some extent, I would say that going through gender transition, let me put it this way, I would be much more compelled to somehow parallel gender transition to other forms of very big life transitions. Chronic illnesses, just, illnesses, period, serious illnesses will force us through some form of big life change. Loss of people we love. People might go through a very bad divorce. The reason why I would equate to that is because in my experience, I found that people who go through gender transition experience an area of feelings and emotions that are very similar to feelings and emotions people experience in another form of these very big life transitions. This is one of the ways where I am able to understand so much of pain points and so much of struggles that so many of you are going through, even though transgender experience is not my experience, is because the feelings, the underlying feelings and emotions are the same. I think, equating it to tattoo is quite a bit reductionistic. But regardless, in contrast to very other big life changes, especially life changes that are not caused by external events, I think that a lot of emotions and feelings might overlap and be similar, even though very different situated context-wise. I do think that in terms of just gender expression, that can be more equated to tattoos, right? By gender expression, I mean is our ability as society, as human beings, to be able to gender bend more, to be more gender expansive, to be more gender curious, to be more stepping in the place where we can give ourselves permissiveness to get outside the bounds of the strong binary representations and to play and explore within those bounds. I think that's a great thing, and I think to some extent we're starting to reach that in some parts of the world. Hopefully we're going to get to that part even more so in the future, but that's what I gotta say. I wouldn't necessarily equate it to tattoos, but I think there are similar overlapping feelings and emotions if one going through a very big life transition. But it is contextually incredibly different and depends contextually on a lot of other factors. Another one that just immediately jumped to mind is that I think one of the challenges about gender transition is that it is so still unacceptable in our world, right? To identify as transgender and then to actively pursue gender transition is a no-no. A life-altering event such as going through terminal illness, cancer, for example, is acceptable, right? It is a medical diagnosis. People look at you as, well, you didn't have a choice in it, and this is still seen as a choice. That's another, I think, big stumbling block here, is that culturally how we look at it. Next question for today. I'm trans feminine and live privately as a woman while at home. I love living as a woman inside my home. My egg cracked relatively recently and I'm still too scared for my safety and being discriminated against to present as a woman outside my home. I do not want to go on hormones because I'm afraid physical changes like developing breast tissue will cause me to be outed. I guess I'm not ready to be open about being trans in public. Do you think that if one is too scared to present as a woman in public and does not want to go on hormones, that it is possible in the long term to simply be happy living as female in private? Alternatively, if it is better for a person to be unapologetically their authentic self with other people, how can I build the skills to not be afraid of discrimination and simply live with possibility of not being accepted? Very good question, two-part question here. So for the first question is, can somebody is it possible to live long-term in privately in a relationship to your authentic gender? The answer undeniably is yes. Millions of people are doing it. A lot of my viewers are doing it. You know that. A lot of people have circumstances or live in environments where safety is paramount. It precludes you from doing anything. And so one has no choice but to cultivate a private connection to their feminine. So yes, absolutely possible. When we factor in long term, when I think about long term, what I like to factor in is sustainability. It's not so much, can you continue this for another decade? It's continue it for another decade in what shape or form. If you're going to do it privately for the next 10 years, how can we find a way to do it where it is actually makes you feel more connected to yourself? And when you do feel discomfort or any shred of distress, how can you also combat that with healthier ways of coping versus maladaptive or destructive ways of coping? So this is first thing to consider. Because can you do it privately? Yes. The question then becomes what that would look like for you in terms of just overall well-being. Because remember, keeping something as a secret, and especially if you see that as a secret, will kind of eventually eat away at you. It just always does. So you kind of want to almost restructure and to re-narrate how you see it, create a narrative around it that is much more fitting to your circumstances, much more aligned with you, and feels much more sustainable and healthy. But alternatively, you're asking if it's better for you to unapologetically live authentically, completely as yourself, how to do it. So again, safety is an issue. You already bring it up that you are holding back and you're hiding yourself because of fear of discrimination. There's a difference between I'm afraid if I'm going to go out there and start evolving into myself, I'm going to get misgendered, or I'm going to get some kind of negative verbal, commentary out there from other people. And there's a difference between if I start stepping and evolving into my authentic self, this is just unsafe. I'm putting myself in a harm's way. I'm putting myself in a position where people can and will harm me. Very big different things. Almost everybody who steps in the gender transition fears discrimination, fears misgendering, fears any of those things that are very socially uncomfortable, that a lot of you are going to perceive as awkward, uncomfortable. All of those things that are socially, a lot of times make a lot of people feel like they don't belong. Right? Being out in public and having people look at you and not knowing what people are thinking and feeling uncomfortable about that, being misgendered, having somebody stare at you, correcting people with their pronouns and them not respecting your correction of your pronouns. All of those things are something that a lot of people naturally are afraid of, but they still move forward because they realize that living authentically outweighs the spirit of discomfort, because this spirit of discomfort eventually for a lot of people does go away. So that's the first thing to consider if we're talking about period of discomfort or we're talking about safety issue. If safety is at stake and you're thinking about unapologetically living as yourself 100%, knowing your safety is at stake, I don't know what to say. That's clearly is everybody's, adult decision to make. I would not advise it personally because your safety is paramount. Your safety is important. If you are unsafe, something happens to you, and then you're in a position where you can't live your life authentically at all, what is the point? Are we talking now about here? Yeah, it's just, I would not. But if you fear a period of discomfort, if you fear discrimination, then the way that I would approach it is baby steps. Little tiny baby steps. Start slowly. Start slowly presenting more consciously. Start slowly doing other things that you want to do that are in touch, in an alignment with your femininity. If it is having longer hair, grow out your hair. If it is starting medicalizing hormones and you really want to do that, start doing that. And if you are afraid that your chest is going to start giving you away, that also could be an indication that the next little baby step could be to start coming out to people who are close to you, to people who might be wondering why your body is changing. Slow baby steps are what's going to help you step more and more into yourself. The more you step into yourself, the more ideally what happens is that you start feeling affirmed and you start feeling good. You start feeling happy. You start feeling, there's still going to be obstacles, but you're going to start feeling like you're coming home to yourself. The more you're going to start feeling all of these things, the more you're going to find a reason, a meaning, to keep moving forward. And all of those things you're going to feel ideally should start outweighing your fears of discomfort, your fears of discrimination, because you're realizing that you're doing it for you. And in the end of the day, you're the ones that have to be happy. You're the one that have to be joyful. You will meet people out there who will say something, who will look at you a particular way. But guess what? You don't have to be friends with them. You don't have to go to bed with them. They don't pay you rent. They don't pay you bills. There's the people you see and then you don't see them again. So you realize you're doing this for you, and that's all that matters. So that's how you do it. Baby steps, baby steps, baby steps. Great question. If anybody else has any kind of guidance or suggestion, please comment below. The section below from you, all of you dear viewers, is just as invaluable as me giving any feedback. Really, really good question. Question number 3. As an Australian, finding you and your content has been a massive relief and a source of great comfort to me over the last 2 years. So, firstly, thank you for all that you're doing. You are so welcome. I love it when international people get a hold of the content. I worked with a lot of people internationally and continue to do so. And I love being able to help in the shape and form. It's incredible. Assigned male at birth, I'm almost 61 and trans femme. My egg cracked almost 2 years ago. Since then, I have been doing what I can to explore my femininity. I have started counseling and hope to discuss gender identity in the future. I just can't do anything concrete about it yet, as I am my wife's sole carrier and have serious concerns that coming out to her would worsen her fragile state of mental health. I also think that she will not at all be accepting of me coming out as trans if I do. I am even questioning whether I actually am trans or whether I am feeling this in reaction to our situation somehow. But I don't think I am. What are some of the things I can do to lessen the desire to explore my femininity or make it bearable? I don't want to leave my wife, but I'm struggling to make sense of who I actually am. I fear it may take years before I can safely talk to her about this. This is a great question. I'm trying to think where to start because if you are a regular viewer, or if any of you are regular viewers of my content, you know that I have a very strong personal opinion, and again, just an opinion, about relationships and not disclosing things in a relationship when you are already aware about your gender identity. I do think it's really important for partners to know. The crux of relationships is honesty. Without honesty, relationship cannot thrive. Also, it sounds like you keeping that part of yourself hidden is starting to suffocate you. And that's not going to serve you, it's not going to serve your wife. What happens is that people are in similar situations, have all sorts of personal reasons why they feel they cannot share this with their spouse. In your case, it is you're afraid that her mental health is so fragile that she won't be able to handle it, one, and two, that even if she's able to handle it, she's not going to be able to accept your identity. So there's the fear, right? Fear of somebody not loving you for who you are, fear of that person abandoning you, and then there's the fear that somehow you're going to be responsible for what might happen to her mental health. And people, even you viewers, have probably been in situations where something was similar. I can't come out until my kids are old enough. That one is a very common one I hear. I can't come out because of this or that, or it will completely devastate my wife. All of that leads to avoidance. I hate to give all of you this tender, loving punch, but I don't want to lie to you. All it is just avoidance. You're coming up with reasons and justifications because you are afraid. Totally get it. It's a scary thing to come out in general. It's a scary thing to come out when you already having a feeling that she's not going to be accepting. However, avoiding this and keeping yourself at bay is only going to create so much pressure internally within you that it's going to start negatively affect not only your health, but other spheres of your life. Your wife, alternatively, chances are, is going to start feeling something is off. She's going to start making assumptions. She's going to start creating in her headspace all sorts of realities, true or not true, of why this is happening. She's going to start sensing your sense of withdrawal, your sense of dissociation, you overall not being you. Eventually, all that pressure builds up to the moment where you're going to burst and you're going to tell your wife about your trans identity. What's going to follow then? She's going to look at you and she's going to feel betrayed that you have known for a longer period of time than she actually expected and never even told her. And that's just a sense of betrayal is going to be much more difficult for her mental or anybody's mental health than you just sharing that you're struggling with your gender identity. People wait. They wait and they wait and they wait, and then they can't any longer wait, and then they just combust. And again, when they combust, it's like a bump went off, and then the partner feels hurt, the partner feels betrayed, and I get it. I would too, would you not? Put yourself in your partner's shoes. If the tables were turned, you would want them to know that they can trust you with something so personal, regardless of whether they are going to be able to stay in a relationship or not. So honesty is very important. Not only important for relationship, but because delaying is not a solution. I never seen it work. It always combusts. It always leads to dire consequences. Comment below if you've been in that situation. Just showcase this. I hear that your femininity wants to come out because you're asking me, how can you lessen desire to explore your femininity? If the desire is already there and your egg has cracked and she's out and about, you cannot put her back in a box. You cannot put her back in a box. You just can't. She knows she's out of the box. That part of you knows. And that part of you is going to create things to self-sabotage you even keeping it away from your wife. Let me tell you this as a psychologist. So, how do you make it bearable? I feel like if me giving guidance how to make it bearable goes counter my value system when it comes to relationships, right? Again, I'm not saying that. Please understand that my opinion that I think you have to be honest with your wife is just my opinion coming from my value system, right? And as a psychologist working with couples and any therapist working with couples, when we are learning about couples therapy, honesty is always crux. I never met a couples therapist who has a couple they're working with, and then the husband or wife says, or whatever gender partner says, you know what, I'm actually cheating on my partner, but please don't tell them yet. Any couples therapist would say, no, I can't do that. You have to disclose, or we cannot do it. Therapy is not going to work. This is kind of similar situation. You have to share. I know you're scared. I know you're afraid about her health, mental health, but you're not responsible for her mental health. This is not sharing that you are struggling with gender issues. If they're going to do such dire mental effect on your wife, as a therapist, I'm telling you, your wife has got some internal stuff she needs to work on. And that has nothing to do with you. She has some internalized stuff that she needs to look at. She needs to look at herself first and foremost, right? So I would recommend, let me put it this way, I would recommend to aim to have a conversation with her. And you can be honest, and you can even say, I'm still questioning if I'm trans. I'm exploring, like I always say on this channel, it's the best way to if you're really scared to bring up conversation with a partner is I realize that I don't feel comfortable with my gender, and I'm in a process where I'm starting to explore what it all means for me. Versus if I identify as a trans woman and I really want to start medical surgical and there's nothing you can do about it. This is a nice, easy way to open up conversation between the two of you. That is leads the doorway into honesty because you're starting off on honest grounds. So I really encourage for you to start conversation, start gently talking about it. You do not want to wait. Like you said, I fear it may take years before I can safely talk to her about it. What if you believe it's going to take years and it's going to realize that your perception is that it's never safe to talk to her? Again, I really encourage for you to find a way to start the conversation. Otherwise, like I said, people who do it long term like this, who just try to make it bearable, are struggling in some shape or form. They're struggling internally, they're struggling externally, they're starting to get health issues, they're starting to get all sorts of things, heightened state of anxiety, they start losing their sleep, they either gain or lose weight, they start having astronomical issues, high blood pressure issues, or they just start using other unhealthy ways to deal with it, dissociating, and the partner's like, hey, what's going on? Why you're not present? What's happening with you? What are you thinking about? They're starting to come up with all sorts of scenarios, and eventually something has got to give. I'm going to say one more thing, because I love you all so much, and because I feel like all of you deserve tender, loving truth, okay? Change is hard, and I'm not here to sugarcoat anything for all of you, because I have seen that sugarcoating doesn't serve anybody. It doesn't serve any of you. Here's another thing. When I hear scenarios like this, where a person tells me, I cannot come out to my partner because it's going to destroy their health, because they're not ready, because, in other words, you have all of these reasons, right, that you have, you really think are true. A lot of times I see, unfortunately, we tend to do that because we are either the type of personality or a type of individuals that copes in this way, where instead of stepping into discomfort of confronting truth, we create avoidance tactics like this as a way of self-preservation, and wait subconsciously, this is like almost an unconscious way of dealing with it, subconsciously waiting for the other shoe to drop on their end. In other words, we're waiting for something either drastically to happen where it's out of our hands and our back is maybe waiting to combust, right? So our back is completely against the wall. And now, I have no choice. I have to come out. Creating a scenario where any choice to actually confront and step into discomfort is eliminated, and we're almost forced into it. You know that phrase, having your back against the wall? Sometimes people will do this. It's like they're going to wait until things get so bad where they feel like they have no choice. And somehow that's supposed to make them feel better. But it doesn't. It never does. And then the way chips fall, it's just so much harder to like piece it together. So please don't do that. Please don't. If you're doing that, please don't do that. So something to think about. Not easy one. And relationships are hard. Being honest in relationships is really, really difficult. So I'm in no way dismissing your pain, but also do encourage you to step into the truth no matter how uncomfortable it is. It's important to be truthful even to yourself, because in not confronting this with your wife, you are betraying yourself, and in betraying yourself, you are betraying her. So just think about that. Good question. Next question. So question number 4. My question: how does a midlife trans woman who's long since lost her hair from decades of aggressive male pattern baldness make peace with the idea of being in wigs for the rest of her life? Because I'm struggling, especially with the idea of swimming, working out, etc. I'm not a candidate for hair restoration surgery or hair regrowth therapy like many others are. Thinking about this always causes me second guess my transition. First of all, I'm really, really sorry to hear that you have experienced this. This is incredibly devastating to anybody. Hair loss is devastating, I think, to all genders, but more so devastating to femme individuals, right? Because hair is just seems to be very important to femme individuals. It's also, it's also a very femme kind of symbolic thing. So how do you make peace with this? There's not going to be an easy answer to this, because the way you make peace with something that has happened in your life, that is painful, that is hard, but that you just cannot change. That's just, it is what it is. you just have to find a way to let it go. I know, you're like, how the heck do you expect to let me go of this? This is so painful for me. It even makes me second guess my transition. So, look, what I mean when I say letting go is this. Things happen to us in life, to each one of us, to a lesser or greater degree. To some of us, horrible things happen. A lot of you know I had cancer when I was 16. I have a prosthetic knee. I have incredible physical limitations with my leg. I'm not comparing this to what you're experiencing. I'm trying to illuminate a point that we all had things happen to me. Somebody lost a spouse, somebody lost a child, somebody had experienced an aggressive male pattern baldness, and now it's affecting how they relate to their feminine. It's not what happens to us that is beyond our control is incredibly painful in of itself. But what continues to cause lasting pain and suffering is not that this has happened. It's how we continue to relate, think, and mentalize it in our daily life. What narrative are we constructing around that event? It's like that cliche thing for everybody. One of us is so tired of hearing. It's not the things that happen to you. It's this, what you make of the things happening to you. And it's a cliche because it's true. It is true. Undeniably, this is very painful when you are going through transition and you're stepping into your feminine and hair matters to you. Also, it's important to let it go because sounds like nothing you can do other than getting the wig and hairstyles that you love, getting other creative with, people do like a beautiful silk scarf to wear on their hair hats, like getting creative with hair accessories that make you feel empowered. And paying attention to when this internal negative narrative around this one event in your life is affecting your entire womanhood. This is not about forgetting about what happened, that this happened to you, or that you have this painful experience. I will never forget that I had cancer, ever. I'm constantly reminded about physical limitation anytime I have to do certain physical things, constantly. But there's difference between being reminded and dwelling on it, or there's difference between being reminded and feeling this way, I have to go for an event, I can't wear high heels, why can't I be just like every other woman? Or I have to fly somewhere and it's uncomfortable for me to sit for a long time, or whatever it is. It's how I think about it. I either accept I'm gonna wear flats for this event. Okay. Yep, I'm gonna fly, gonna have to get up multiple times, right? That allows space mentally to focus on other things that are important, because giving energy and mental power to something we cannot change is only going to breed suffering and pain, because you are almost like sitting in the soup of turmoil, but you keep creating the turmoil for yourself because the event has happened. Like cancer has happened. Do you know how long ago cancer for me? I was 16 years old, I'm 44. Am I reminded of it every single day just by seeing my big scar on my leg? Yes. But do I dwell on it? No. This is what I'm talking about when I say letting go. It's not that you pretend like it's not happening to you. It's that you allow yourself to take more active steps to acknowledge that this has happened. You cannot control it, but you can control how you see it. You can control how you create narrative about yourself as a woman, and how you can choose to move forward with it. This is where, again, acceptance comes in. Acceptance, and also radical self-love and acceptance, that's where it comes in. This is how trauma heals. We never heal trauma in therapy, ever, in my opinion. we help clients, patients to reframe narrative so it doesn't cause them pain and suffering. It doesn't mean they forget what's happening. It doesn't mean that they're now have a narrative that this is for the happy event in their life. No. But they have a narrative that it allows them to let it go while still remaining there, but being in a past, so it's not constantly in the forefront. So I encourage you to think about what narrative do you make about it, and try to work on that. Try to work on that, because this sounds like it's really affecting you drastically, and it's stealing away joy and happiness and enjoyment of life that you can otherwise have. Great questions for today. If you have any kind of feedback for these individuals, comment below, share your insight. And if you have a question for me, please go ahead and email it to me. My information is below. Please like and subscribe to this video. That helps me tremendously. And I will see you all next time. Goodbye.